Good morning, Indiana recovery community. My name is Jay Chaudhry, and I am the director of the Indiana Division of Mental Health and Addiction. You may remember that I spoke in person, as hard as that is to believe, at this conference last year. I was about a week into the job, and I was terrified. In the year since, I have met and gotten to know many of you. I have learned so much about your amazing work, and on behalf of DMHA, I thank you for everything you have done to maintain connection and build resiliency during this crazy time. Last year, I challenged this group to start moving past recovery is possible and work towards building a world where recovery is expected, and offered some very preliminary thoughts on how to get there. Over the summer, DMHA adopted a new mission and vision, and we think that following this path will help us build that world. Our new vision is an unyielding focus on promoting and supporting the mental health and wellness of the people of Indiana. This vision is a reminder to us that no matter what other noise we encounter, our focus should be on what is best for the people that we are here to serve. Our new mission is to champion mental health promotion and substance use disorder prevention, treatment, and recovery systems that are high quality, seamlessly integrated, and accessible to the people and communities of Indiana. This mission is meant to provide the framework to help us achieve our goals. Our three core principles are systems that are, number one, high quality, number two, seamlessly integrated, and number three, accessible. Many of the programs you will hear about during this conference embody many or all of these principles. In particular, the expansion of the Indiana Recovery Network's recovery hubs exemplify what DMHA is trying to accomplish. The hubs are high quality, with a peer workforce that is trained and credentialed to the highest standards. They are working towards seamless integration, both with each other and all the various other systems that people in recovery encounter. The legal system, treatment providers, childcare, etc. Finally, they are accessible, both geographically and through the use of technology, to both peers and the people that they serve. As we continue as a state to innovate and lead towards making Indiana a mecca for people in recovery, we hope that DMHA's core principles provide a guide towards building an Indiana where recovery is not just possible, but expected. Thank you, and have a great conference.
Good morning, everybody. My name is Blake Wood. I'm with TechServe Corporation, and I'll be helping to facilitate today's seminar. Our first session of the day is entitled The Role of Community Health Workers in Assisting with Re-Entry Following Incarceration and How They Can Assist with OUD and SUD Prevention and Recovery. Our presenters this morning are Paul Conrad and Julia Holloway. Paul Conrad serves as Director of Training and Workforce Development for ASPIN. Paul graduated from Central Michigan University in 1986 with a bachelor's degree with dual majors in history and political science. He completed the teacher certification program at Aquinas College in Grand Rapids, Michigan in 1993 with a major in secondary education. He has held teaching licenses in Michigan and Indiana. Paul has been with ASPIN for 12 years and oversees ASPIN's workforce development programs. These programs currently include the ASPIN Chronic Care Education and Paraprofessional Training Program, ASPIN's Opioid Workforce Expansion Program, and ASPIN's Certified Community Health Worker Training Program. Paul is also currently an ambassador for the National Association of Community Health Workers. Julia Holloway serves as Director of Program Development for ASPIN. At ASPIN, Julia manages the Health Navigator program funded through the Centers of Medicaid and Medicaid Services, known as CMS, as well as several health resources and service administration, known as HRSA, for their grants, including a recent network grant. Julia has experience in community service and a comprehensive background in leadership, government, grantsmanship, community planning, healthcare initiatives implementation, evaluation, constituency relations, and systems analysis. In addition, Julia has served on a number of state and national stakeholder work groups for healthcare access. She received her Master of Business Administration degree from Indiana Wesleyan University and has a bachelor's degree in political science from Indiana University. She has received additional training for rural community development and healthcare from the North Central Regional Health Center for Rural Development. And so that concludes our introductions for our first seminar, and I'll hand it off to Julia to be the first presenter. Julia?
Thank you very much. Good morning, everyone. And again, thank you for allowing Paul and I to speak about community health workers and ASPIN's efforts to getting this valuable segment of our workforce training and experience with re-entry. Next, please. Our learning objectives center around the value of CHWs working with criminal justice organizations to connect individuals with health resources, understanding the arrest processes as part of navigating the criminal justice systems, the impact of CHWs can make on individuals' recovery, and then some current initiatives working with jails. Next. Connecting individuals. Next. ASPIN staff has been working with CHW certified navigators in jails starting when House Enrolled Act 1269 became law. Another one of our initiatives, our opioid workforce expansion program, a paraprofessional training that we will talk about in greater detail later in the slides. We were able to secure funding from HRSA, Health Resource Services Administration, to provide this training. The training is built on having experience and learning more about the criminal justice system. This is a unique program for Indiana and consists of about 43 hours of combined training and experience. Next. The funding opportunity and ASPIN's ideas to build the program was based on the growing need for treatment. Some of the statistics we looked at were over 70,000 drug overdose deaths in the US, increased overdose deaths in Indiana, over 22% in a year's time, the need for comprehensive paraprofessional training in SUD and OUD, as well as CHWs and education paraprofessionals are a fast-growing segment of the healthcare industry. Next. So I'd like to stop here and ask you all a couple of questions through online polling. The first question is, do you presently work with individuals who are involved in criminal justice? And if everyone wouldn't mind checking by their response, and we'll see who we have here today. So, like, do we have our responses? Oh, I see. So about 34% of our clinical staff and HWs, and about 4% work are in law enforcement, and 39% did not. So let's go on to the next one. And I think that was hidden from me and I moved my screen over a little bit. So let's go to the second question. So how many attendees have visited a jail or prison facilities? Okay, so about 40% have visited as a visitor. 14% of you say you never visited. 16% were there due to an arrest incident. 3% legal representative, and 27% of you work in the jail. Our last question is just based on some information we received on CHWs. We also would like to know if you or your staff are interested in training on how to work with individuals or families involved in the criminal justice system. Oh, 80%. Well, would be interested. So that's great news. We'll talk more about, and we've got some things we want to talk to you about then. Next slide, please. So just like we surveyed all of you, we right before this presentation, we sent out a survey to CHWs here in Indiana, and this is what they told us. About 30% of them had worked with individuals in jails. 25% had worked with individuals that went through diversion courts. 41% are currently working with individuals who have been involved in the criminal justice system. Of those who responded have been CHWs up to 7 years, and 54% said that they needed more training to work with individuals involved in criminal justice. Next, please. So they also, here are a number of titles that people, and so we made a word cloud to illustrate titles that CHWs that might be working with criminal justice would be known. Case managers large there, peer recovery coach, somewhere CHWs, peer engagement specialists, navigator, and so forth. Next slide, please. The skills CHWs told us that they needed in the survey, some of the things were that the process for rules for being in jail, dealing with individuals who abuse opioids, understanding how the criminal justice system works, re-entry issues that some folks face, not just drug use, but other long-term health impacts from being in jail, and working with family members. Next. So like I said earlier, we've been enrolling folks in jail through our Navigator program since 1269 started. We've enrolled about 4,200 individuals before they left jail in that Healthy Indiana plan. We've also been training CHWs, over 1,000. So we've been working on creating additional training for CHWs. Start with the core CHW certification, and over the years, CRS. We have our health insurance enrollment navigators. We have chronic care professional training. We're training on opioid prevention, treatment, and recovery, and training in assisting families impacted by opioid use. Next, please. So just to remind everybody who aren't as familiar with CHWs, CHWs need to be 18 years or older, must be a current resident of Indiana to receive training, and have a high school diploma or GED. And with this certification, you don't have to be in recovery. And I also want to note that however the minimum is a high school diploma or GED, we have a number of individuals with college degrees or working on a college degree that sign up for the training. Next, please. This slide just shows the focus of our training to help with the criminal justice involved, the community health worker training, and then opioid basics for CHWs. Next, please. The training process, there's two classes, 2 exams. And in this time of COVID-19, we have virtual jail placement. Next. If you're already a CHW, you just take the opioid basic modules or both, and you can see the hours of training that we have for that. Next slide, please. Also want to mention that the training is certified or recognized by a number of organizations, and it's particularly now it's a approved career training with Work One, and certified by a number of other organizations. And now I'd like to turn over this presentation to my co-presenter, Paul Conrad.
Thank you, Julia. I'm going to do a little bit of a deeper dive into some of the actual things covered by the course, and some of the, I think, unique features of how we do this training, particularly in the time of COVID. Much of our training, before I dive into it, was developed in association with the Indiana Sheriff's Association. And what we're going to talk about now is a little bit of what you'll see in the training, what it covers, and some of the scope of work, and then what some of the interesting things that are happening out there. Next slide. As Julia said, we have field placements in our programs. Originally, we designed these to be live. I had the very unique experience of getting to visit the Johnson County Jail and the Morgan County Jail prior to COVID, and I was very excited about our students being able to visit those and other jails that we were working with, and then there was COVID. So we couldn't do that anymore. And I'll talk a little bit about how we overcame that in a minute. And then also, there are placements in a behavioral health setting so that the students can learn what it's like to be in behavioral health, the behavioral health environment. I have a background in teaching, as you heard, and one of the most valuable things that I always thought that I received in my trainings were the student teaching experiences and the placements that I received while I was in school. We are very strong believers in people being able to see what the job is like before they take it so that they will succeed, rather than decide 3 months into the jail job that they don't like it. So next slide, please. We also acknowledge, however, that many people have been in the field for a while, either as a CHW or working in our jails. And so what we've done, and we have had this approved by our grantor, is that we have a field experience checklist that we use. So for example, if you've been working in the behavioral health setting for several years, we're not going to make you go through a placement. And you can see on the slide here some of the things that are on our checklist that we would have a supervisor sign off on. And the newer one is the jail checklist. And that's where we have people experience the booking process, view an intake and screening, view a holding cell, and talk about pretrial diversion and the bail process and court expectations, the kind of things that that you would experience in that criminal justice system. And we were very excited about being able for them to do that live and go through a jail tour. But unfortunately, as I said, that didn't happen. Next slide, please. Just wanted to give you a taste of a little bit of our curriculum. Obviously, it's much more in depth than this, but these particular slides are right out of our curriculum. And so I'm just going to give you a few examples. And of course, as I said, we do go more in depth in this, but we do go through the chronology of the arrest process and what happens there. And again, as I said, this was all developed in conjunction with the Indiana Sheriff's Association. So I learned a lot. I had not been in a jail. I have to say I've never been arrested. So it was a very good learning experience. It was very, and I just like this because we came up with curriculum and then we ran it past our contacts in the Sheriff's Association and said, well, no, that's not really what this is. We wanted to make it as real life as possible because I'm very much about experiential learning. Next slide. So again, we talk about the different, this is again in that chronology, and we talk about what happens when a person is booked, and you can see on the slide, and little tips like this fourth bullet point are the kind of things that I think make our training very valuable. And that if you can't see it, if you're working in this area, you must never assume that the police have completely searched the detainee. Always use caution in this area of the jail. And that's one of the things that our contact pointed out to us, which personally I would have just, if I would have been working as my first day on the job as a CHW, oh, they're in jail, they've been searched. Well, not always completely at this particular point in time. So it's these kind of things that I always thought that I've always enjoyed about our training. And we have many tips like that. Next slide, please. So because of COVID, as I said, we were unable to do these jail tours. So we were challenged, well, how can we come up with something that's just as valuable? And we spent, my team, the workforce development team at ASPIN, spent an awful lot of time scouring the internet, asking for suggestions, and we came up, and this is just a few, these are some highlights, and you can watch them on your own time because of technical difficulties and time constraints. We really couldn't go too in depth here, but we went out and found some videos that were already existing that basically covered most of the topics that we wanted. Particularly, I want to point out that third one. I was very impressed. I know it's Iowa, but when I watched this jail tour, it was like the tour that I had in Johnson County. It was very, very similar. And so it's an hour and 48 seconds, and it's the sheriff, and I believe it was the sheriff of that particular jail, not the jail commander, walking a group of townsfolk through the jail and experiencing all of the different sections of his particular jail. Very well done. The other two, the holding cell in Kent County, Michigan, which is where I grew up, is a jail orientation video and shows the inside of a holding cell probably better than some of the tours would. And then the booking process. And I was very impressed by this particular sheriff's office down in Florida because they have about 60 different videos on different topics, all produced at their jail. So I highly recommend, if you just want some quick, interesting tours and you can't take our class, to check these out. So, but I think it does a pretty good job of showing our students what it's like. Thank you. Next slide. No, not stay at this one. So this, as Julia referenced this a little bit. You can see we've had, this is the first year for this, we're starting on our second year, but we've had 95 students. Our program completion rate is, it was a little slowed by COVID, We had a huge influx of students. The first year we didn't get started right at the first part of the year. But the more interesting thing here, I think, for our audience is our level of education. As you can see, people with degrees outnumber people without degrees. So while we have had quite a few people with only a high school diploma and some college, we've had a considerable amount of people with associates and bachelor's degrees and a couple of masters. So as you can see, I think this program has value across the spectrum. And one other thing, we did have, this was as of last week, we have 6 additional people from IDOC entering the program, which was amazing for us, both in this program and our chronic care program. Next slide, please. Next slide after this, thank you. So studies have shown that CHWs are effective in this situation. Like all CHWs, basically the definition of a CHW is a frontline public health worker who is a trusted member of and or unusually close understanding of the community served. This trusting relationship enables the CHW to serve as an intermediary between health and social service and the community to facilitate access to services and improve the quality and cultural competence of service delivery. Sorry, it's Monday morning. And that's the definition by the American Health Association. So when you look at the definition of what a CHW is and you look at how we can help and impact, they just fit together naturally. Next slide. What we're focusing on here with these programs are training a group of individuals who can assist prisoners or persons released from jail or in prison in that warm handoff, or as it says on the slide here, obtaining for their families and link them services and link them with support and facilitate medical and mental health care. And that is important because even if they're receiving excellent treatment while they're in for whatever condition they may have, SUD, OUD, or whatever, if they're lost in that transition back into when they're released, then it's for naught. And so what we're trying to do here is develop a workforce that can help assist with that warm handoff. Next slide. Because CHWs are hopefully trusted members of that community, they can help reduce that stigma that ex-inmates feel because of discrimination and those kind of issues that, of course, most people are aware of when someone is released from incarceration, and again, reintegrate them into the community and again keep them connected to the services that they've received. Next slide, please. So what are some of ASPIN's providers doing? Next slide. We are some of ASPIN's providers, and we are a behavioral health network made up of community mental health centers and addiction providers. And we have some that are beginning to use CHWs to work with individuals that are involved in the criminal justice system. They're helping to begin that assessment process in the jails, and again, work with the people during reentry to do that warm handoff. They're using CHWs in recovery works, making sure that they get their appointments scheduled, medications waiting for them, all that kind of stuff that any CHW will do. Other providers we found are not using CHWs because the reimbursement rates are, for some, are not as high as they could be. And I know the state is working on those kind of issues. But people are finding ways for CHWs to help. And as you saw from the word cloud slide, I think a lot of people are using CHWs, but they're not necessarily calling them CHWs. And so one of the things that we're trying to, part of our efforts, are to educate the public. According to the National CHW Association, there's over 200 different job titles that fall under the umbrella of a CHW. So you may be using them and you don't know them, you just don't call them that. So Next slide. We have to have this because of our grant, so just want everybody to know that our opioid training is funded by HRSA and that we are an approved training provider by OMPP. Next slide. Just want to thank everybody, and I think we have time for questions. Any questions?
Well, Julia, we do have several questions.
Okay.
First one is, when we look at the community health worker roles within the jails, are there any clearance or other certifications that you would recommend in addition to community health workers?
Julia, well, yeah, well, healthcare navigator is a good one to have because they're, and I, go ahead.
Well, and I was going to say, whenever we've worked with jails, individual jails have some parameters depending on the size of the jails that they want. I know we're asking about certifications, but I think it's always good to work with the local jail on requirements too. So, and we do have that community health worker. One of the things that people noted was helping people with other health issues. You know, we do focus a lot here on recovery for SUD or OUD, but we also, a lot of people in jail as they're reentering have chronic issues. And so having some specialized training in some chronic care things too.
Yeah, and that's what one of our other CHW related programs is the base CHW with an additional chronic care professional, paraprofessional training. So I think those are two things that you could have that would be very helpful.
Fantastic. We have quite a few more questions here. On average, how much do community health workers make?
That, since most of those statistics are self-reported, the last time I looked, and I have to admit it's been several months since I've checked the status, but you can actually check that online through the Department of Labor. But I believe the range was at the low end, roughly, I think it was $15 an hour. I think we've heard self-reporting that it's more around 13 to start. But then as you, and it is, many people consider this to be an entry level position. And so we've heard all the way up, I mean, some states it's quite high, but all the way up to between 13 to $18 an hour, depending on the facility. Some of it depends. If you're working for a nonprofit, you're gonna make less, but we also know that some of the major insurance companies, for example, have run people through our community health worker training, and I would imagine their pay scale is higher.
Thank you very much. Additional questions on eligibility. This may have been answered previously, but are previous felons or those with a conviction record, are they allowed into the jails as a community health worker?
Julia, you've had more experience.
Well, I think you'd have to work with the jail, and I don't know about the CHW certification as far as getting. Can you still be certified, Paul, as a CHW?
That is not a limiting factor with CHW. There are other regulatory issues revolving around that go around with that too. But you can get the certification, and that is one of those things that comes up quite a bit as we're trying to get a peer workforce, and by peer it can be anybody who's had life experience. It doesn't necessarily have to be an addictions related peer, but if you're going to be a peer that works in the jail and that's what your peer is, that's going to be an issue. So it's one of those things that, you know, we have to keep continuing to work through. But I guess the real answer would be it depends. Now, if they wanted to be a healthcare navigator, I believe that is a disqualifier for that. Am I correct, Julia? Yeah.
Correct.
And that's a federal thing.
Great, thank you. In addition to that, there's some questions on how to enroll for the course. So regarding that question, how do you enroll, and are there virtual classes?
Yes, I can answer that. Yes, the whole program, and strangely enough, we had virtualized everything but the field placement for this class prior to COVID. That was just our instructional model. We wanted to make sure that people from any part of Indiana could view it, and to have to travel to a central location for a class was not, we've learned in many years of training that that's not always the best model. So other than the placements, we had virtualized the entire class ahead of time. So, and now, because of our virtual field placements have been approved by HRSA, yes, the entire class is virtual with instructor led. It is not you just go and listen to things. You interact, you're assigned an instructor, and you interact with real people. We have study sessions, the whole 9 yards. The easiest way to enroll in these classes is to go to aspin.org, which is our main website. And when you're at our main website, if you go on the, depending on what program interests you, if you go to the ASPIN website, you will see on the right-hand side of the screen our programs, and they are all listed there. This one, yes, thank you. This one is the ASPIN Chronic Care Education and Paraprofessional Training Program. It's a specific program that we've been talking about today. You'll also see we have the base community health worker program. We have the opioid workforce expansion program. I'm sorry, the opioid workforce expansion program is the one we've been talking about today. And many of our other programs. So, and then that'll take you to a sub-site and you can register online for the courses.
Thank you, Paul.
And just so everybody knows, we're trying to run our courses in cadres, and so we are forming the next class, which will begin in December for all of our programs. So if we have time, but if you enroll now and you want grant-funded training, we will be starting the next group through in December. And there'll be 20. Go ahead.
Sorry about that. Could you speak to any scholarships or cost to attendees through your funding?
I was just going to do that. Okay, so as we've alluded to in the presentation, both the Chronic Care Education and Paraprofessional Training Program and the ASPIN Opioid Workforce Expansion Program are both funded through HRSA grants. We train approximately 70 students per year each through those grants, and we've broken those up, as I said, into cadres of 25 roughly. And so they are 100% grant funded. And so you can sign up, and if you qualify, and there is an interview process, just to, because we sometimes do have quite a backlog of people, there's an interview process. We do have targeted counties, and you'll see those on the websites as you go through. I don't have them all memorized. But you can also, if you, for example, just wanted to go through the ASPIN Community Health Worker Program, currently, at least through December, we do have funding through the DWD Workforce Ready Grant Program for individuals, and they would, and if you go to the CHW site, you'll see the link. You go to DWD's website, you fill out, we contact you, and then we can put you in to the community health worker programs. And then we have some other things that we can do to get you into the other programs, which it's kind of convoluted, but it's a way that we can get you into training. We also have the level 1 grant where your employer, if you're an employer and you have several people that you want to get involved in, as an employer, you can basically get reimbursed for this training. Many of our commercial clients that go through use that, and it's up to $5,000 per student per year. And one of the major insurers, for example, ran a bunch of people through under that program. And then your employer would apply for you and then run a group through. So there are quite a few different ways to get this training paid for. And we'll work with students to try to find the best pathway to get it covered. So
But Paul, you could also pay for it.
Oh, or you could just pay for it. Yeah.
Yeah.
Well, there's that. Yeah. So my best recommendation is just find the program you want, get signed up, and we'll work with you to find the best pathway. And we have people just pay for it, but I always try to get people through.
Paul, Julia, a couple of clarifying questions. Folks were asking that, so to clarify and understand, ASPIN is really a community health worker training organization, not the employer of community health workers. Do you have partners, and what partners and what counties are offering this type of program today?
You want to?
Well, I'll start. Well, networks, we're a network of community mental health centers, and this is what we saw the need, and we have initiatives that ASPIN does as a network that we do for to benefit our network and to benefit the community. And that's what our training program is. As we apply for grants, and Paul can talk about it, things are targeted towards those things. And as far as partners go, Paul, our partner, we do the training, and then we've set up things, especially in this time of COVID, where things are online a lot. We do have staff that have study groups and help people along like that, as long as we're doing things online. But I'll let you talk more about the partners. And
yeah, our partners our primary partners on most of these grants are our community mental health center members and addiction providers that are members of ASPIN. As these programs have matured, we're reaching out more and more to find other people to partner with. We also have resources on our on the web program websites, links to different jobs that are available as far as who's hiring. It's all over the place. We have targeted counties, and our targeted counties were based on each program, grant-funded program, has targeted counties that we identified as areas of need, and we are trying to establish and target organizations within those counties, which is we're always working towards that. And the counties that are our preferenced counties are on our websites, but you know, it's an ongoing, I should say, challenge. But we're finding more and more, and we try to come up with creative job searches that we have links for on our website, using the different names that we've discovered that people are using community health workers. If you go to, for example, if you go to Indeed and type community health workers in Indiana, you're going to get quite a few jobs. For example, the Marion County Health Department always seems to have jobs open for community health workers, but it's expanding more and more. And Department of Workforce Development, who I would officially on paper probably grant writing isn't one of our partners, but we're working with them to help identify more and more people that could use community health workers. And as I said earlier, it's challenging because when you have a skill set that we refer to as community health workers, it has roughly 200 different job titles. It can be a challenge, but a lot of times we say, well, what are the jobs you're applying for? And they come back and I say, well, that's actually a community health worker. And we had a long discussion with one of our own partners just recently. It was Centerstone, and they were telling about a new initiative they had and a grant that they have. And we were talking because we have a brand new grant that I'm not quite ready to talk about in depth yet, but it's another grant that's related to opioid affected families. And they were talking about this new position that they were going to be hiring for. And I said, after they listed the job description, so, you know, that's a community health worker. You're just not calling it that. They're like, you're right, it is. So it's almost one of those things that I know that's not the most distinct answer, but it's one of those kind of jobs that's kind of tough sometimes to nail down.
Thank you,
nine of our staff, as far as asking if we hire community health workers, 9 of our staff are trained as community health workers. So.
Yeah. And they
Thank
do
you, Paul and Julia. Jeffrey Krumer from Community Health Network also chimed in to say that he knows that Community Health Network utilizes ASPIN for healthcare navigators at Howard Behavioral Health. And so just a shout out from Howard and also from the county that service from.
Thank you.
Thank you.
Some questions regarding eligibility. Is this only available to paraprofessionals?
No, as you saw from the one slide, we have people with master's degrees. A lot of it, what we found over the years is that a lot of people, and as somebody who's been through an education program, you can get a lot of education and not a lot of on the ground experience. And so we teach a lot of skills that I think and do a lot of some of the experiential stuff that is not really taught in schools. And so a lot of people with degrees and sometimes, like I said, master's degrees find value in the skills that we teach as a community health worker. Particularly people, and because ASPIN is a behavioral health network, although we do quite a bit of, we work with quite a lot of FQHCs for some of our programs. That's the part that gets left out a lot. If you're going the traditional primary care, you have a lot of training in primary care. They don't always talk about the behavioral health or the behavioral health side of SUD or OUD and that kind of stuff. So we have a unique, we fill a unique niche for a lot of people that already have degrees.
Wonderful, thank you for that clarification. As we all know, September is Recovery Month. What are some recommendations that you have for community health workers in working in environments with the recovery community and also in their own self-care as they look at working with high stress and potentially trauma-informed communities?
Julia, you want to take that one, or you want me to? I've been talking a lot, so.
But no, yeah, you do, and we do have a lot of things that we've been doing for our own staff who's not working directly, kind of indirectly with recovery. But go ahead. I know that's even part of our training is taking care.
Yeah, we do have a module on self-care. We talk about it a lot. It can be a high stress environment, and once you become part of our training groups, we try to send out information on that. As I said, ASPIN is one of the founding members, or not founding members, but we were an early member on the National Community Health Worker Association, and they send out a lot of stuff on self-care, and we try to share that with our students. But it's very important. Particularly working with the addiction side of the CHW picture, it's high stress, and particularly now. And so we always check in with our students. We've had students who have had to drop out, even though it's virtual, because of COVID-related activities. They might not have. We have had some students that have had it, and we've had some students that have had to put their training on hold, and we encourage that. We try to be as flexible and accommodating as we can, because being in behavioral health, we know how important self-care can be.
Thank you. A few questions regarding the grant opportunities that you recently won and/or are the funding in support of these programs. You mentioned HRSA several times. What is ASPIN's overall strategy when it comes to HRSA's workforce development grants for community health workers, and where do you see a further extension and expansion in utilizing this certified role?
I can start on that. ASPIN and myself personally am a big advocate of not recreating the wheel. And so what we've been able to do with HRSA is we had a very long standing training program with our community health worker. And so through HRSA, we've been able to, and Julia had the one slide that had the progression of all the different programs, is we take our base community health worker training, which is always evolving, and we try to add to that as far as we see a grant that fills a need that we have identified in Indiana. We don't just apply for every HRSA grant we see. We look at what we do best, which we have been a training, ASPIN's been around. I didn't wear my 25-year shirt, but ASPIN's been around for 25 years. And we look at what we do best and we try to build on that. And so it's when we see a grant or we're recommended by HRSA that, hey, we think you'd be a good fit for this grant, we will apply for that grant if we think it fits our skill set. And if it doesn't, then we don't apply for it. But I think that's how, I guess I could best address how we leverage the HRSA training grants. We just keep building on what we're doing. Julia?
Well, and I was just going to say, and we try to work alongside whatever state or federal initiatives are going on too. You know, we stay abreast, we talk about that. How can we adapt? I mean, the recent, you know, being certified by the Department of Labor, and we're the first CHW training in Indiana. There's a few other states, isn't that right, Paul, that are in partnership with the Department of Labor on the CHW training, and so those kinds of initiatives building on things, and at this time where people are needing to maybe reinvent themselves for the workforce because things have changed, we are doing that too and adapting. We always have a really good relationship with HRSA, and like Paul said, we were able to adapt our training so it's virtual, and that was just hand in hand with them.
Well, and yeah, to build on what Julia just said, that's we just received, and we had a press release about this. We just received a new HRSA grant, the Opioid Affected Families one that I just mentioned briefly, and as she said, that will be the first. We're working with the department. We will be working with the Department of Labor to develop an apprenticeship program for CHWs, which will be the first in the state. And you will be after you would go through that program, which will be a little more lengthy. Will be you'll have a certificate. I always use the example, just like a plumber, that you went through a certified apprenticeship program that is through the federal Department of Labor. So we're kind of excited about that one. We're developing that now. So we'll have more on that later, and that's opioid affected families with that CHW component.
Great, we'll give a few more, maybe 30 seconds for additional questions to come in. Really appreciate the excellent participation from all of our attendees.
Yes, thank you.
Quite a few questions together. Okay, we have a few more folks typing in. Lots of great comments on a very helpful presentation, and thank you.
You're welcome.
Another clarifying question of, could you share where on the website the counties that the grant is funding today are listed?
Sure. Once you go to the actual, I keep pointing on the screen and it's not mine, so that's not very helpful. But if you go to the specific grant, for example, on AOEP, it's down at the bottom of the page. I'm looking at my monitor that actually has the websites open. And then, which is the ASPIN Opioid Workforce Expansion Program. It still doesn't help that I'm pointing on my screen here. That lists the counties down at the bottom. The accept grant, it's more at the top, and that's just, thank you. If you go down to the bottom of the page there, under all this the good courseware stuff. There's our targeted counties there. So, and then you'll see it's Huntington, I can never say that one. Kosciuszko, is it? Yeah. Kosciuszko, Marshall, Marion, Putnam, Sullivan, Decatur, Henry, Jefferson, and Howard. Those are our targeted counties. If we have, and we are really trying to focus on those counties first, but it doesn't necessarily mean that if you work in an adjacent county or you're serving people in one of those counties, those kind of things will count for you. That's the kind of stuff we ask in the interview process. For the ASPIN Accept program, there's several more counties, and that map is on the ASPIN Accept page. We don't have a full page built for the family grant yet because it's a new program, but you can see there that those are the counties we're looking for.
Fantastic, thank you. There are a couple of comments. Carrie McTarsney stated that she just moved from Washington State to the state of Indiana, where she worked as a corrections specialist in several prisons. And there, once released, you must be out of prison for 1 year before participating in reentry programming. Just as a commentary to the earlier conversation about policy with individuals with prior convictions participating as a community health worker.
Interesting.
And then Christina Slinker provides, she's currently a community health worker, certified recovery specialist for the last 5 years. Christina, thank you for your work. If she's currently certified as a CHW CRS, are there additional courses that she needs to take or participate in?
Yes, and that's one of those little weird variants. If she's, and I assume that she was either trained by us or Nahani up in Fort Wayne, and if she is a certified community health worker in good standing through either of those two organizations, we do have a waiver on our grant that would allow her to take just the opioid jail part of the AOEP grant. Doesn't help to point at my screen again. The AOEP grant, or she could also, if she wanted to take, we also have that chronic care one that I alluded to. She could take that, but not both through the HRSA grant. They have a limit. You can only go to that well once. So as long as, and if she's a CRS, then I'm sure that she didn't use HRSA, any of the HRSA funding to pay for that training. But anybody who is a CHW in good standing that's trained by either of those two organizations, they can apply and just go through the opioid expansion part of the training with that jail component using grant funds.
Wonderful, thank you for that clarification. Well, Paul, Julia, thank you both so much. As the moderator, I'm going to bring this section to a close and invite Blake Wood, our MC, back to share a few housekeeping items on the next session.
Thank you, everyone.
Thank you.
Thank you, Sunny. Paul and Julia, thank you very much for this excellent presentation. We greatly appreciate all the information that you've shared with us today and the responses to all of your questions. That's gotten our symposium off to a really strong start, and we greatly appreciate it. Our next session is entitled The Silent Grind, Firefighter Behavioral Health and Peer Support, PTSD and Suicide Prevention of First Responders. This session will begin at 10 o'clock a.m. Eastern Time. Please remember to use your join link to log on to the webinar to participate. And we're looking forward to having you join us. Have a good morning.